Hi, I'm Dr. Evangelos Milonas here at Kinetic Health in Calgary. This video is about the radial nerve, its anatomy, its relationship to the kinetic chain, ways of mobilizing and stretching and nerve flossing. Just looking at the anatomy of the radial nerve, it starts out here from the neck, it branches off the cervical nerve roots from C5 through T1, comes off the posterior cord of the brachial plexus, and it travels along the backside of the arm. It primarily innervates the muscles on the backside of the arm and the muscles of the forearm. As it travels down and it reaches about the elbow, it dives deep into the forearm musculature, and that innervates 12 muscles that are in this region alone. There's a superficial branch that travels across towards the wrist, and that provides sensation, and it innervates the backside of the hand and the forearm. Any compression of the nerve along its pathway here, or any direct injury or trauma, can affect structures up and down the entire length of the arm and the entire length of the nerve. And that's what we mean by kinetic chain. Anywhere along this entire length can be affected by forces on the other side of the spine, in the neck, musculature in the back and forearm. Now I'd like to discuss some of the clinical significance of the radial nerve. The radial nerve originates here, it travels all the way down to the hand. Any compression or injury along the entire length of that nerve will produce different symptoms. If you have a compression or something higher up in the shoulder, in the neck region, it could refer pain into the triceps, into the elbow. As you come down, a common site of entrapment or injury is close to the elbow here by the supinator muscle. If there's a problem there, it's going to cause problems into the forearm, and there's a very specific distribution along the thumb and the back of the hand, especially when the superficial branch of the radial nerve becomes irritated or impinged. Unlike the median nerve, which we discussed earlier, that causes symptoms more along the palmar side of the hand into the thumb, the index, and the middle finger, and a bit of the ring finger. And the ulnar nerve is the medial side. So nerve entrapments, nerve injuries are very specific. They have distinct patterns and distribution in terms of pain or tingling or numbness. And as clinicians, when we hear these things from patients and individuals, it helps us to focus in and
Hello, I'm Dr. Brian Abelson from Kinetic Health. I'm just going to show you a few tension mobilization flossing techniques you can use to mobilize the radial nerve. Now, some really simple ones, and I'll go back to my high-tech devices here, my tennis balls. And what I'd like you to do is take them, put them in your hand, and basically just turn them over like this. That's all. Some really simple things. Take it right out like that. And we're going to go back and forth. We'll probably do this about 10 times. And you're going to, really take it to end range here, though, to get to the end. Okay, the next exercise we're going to do to mobilize the radial nerve is going to be a waiter's tip. So basically, we're going to take our hand behind as if I got my hand out like this, and I'm a waiter, and I'm saying, hey, I really need a tip. And keep the hand back like that. Now, we can actually increase the amount of tension on this by bringing our head down. So we'll take this back like this, and then we'll bring our head down, back up, bring it down. So this is a great exercise. I'm actually going to show you a little more when it comes to the waiter's tip, because what happens sometimes is we don't just get entrapment of the radial nerve, but we may actually get some entrapment, a combination, maybe the median nerve, the ulnar nerve, and the radial nerve here. So there's actually two parts to a waiter's tip exercise that I'd like you to do and combine them together. Okay, you're going to need to go up against the wall somewhere, and you're going to take your hand flat against the wall. And then you're going to take your head to the side. And what we're doing is we're actually tractioning all the nerves in this direction here. Now if we want to tension it, we take our head out just a little bit, and we can actually feel the tension going down the arm and bring it back. So this is going to be part one. And like this, we're probably just about, maybe about 10 times. Part two is exactly the same as the last exercise I showed you. You're going to take your hand to the side, and you're going to bring this back, and you're just going to go up, looking up, and taking it down. Looking up, and taking it down. This is great for mobilizing the radial nerve, but you can also mobilize the median, ulnar, and radial nerve at the same time. Great exercise.